Cardiac murmurs are classified into three groups based on their timing: systolic murmur, diastolic murmur, and continuous murmur.
Systolic murmurs are murmurs and sounds that occur during ventricular systole. During systole, specifically in the heart, the mitral and tricuspid valves are closed, while the aortic and pulmonary valves are open, respectively. Normally, since there is no gradient between the areas before and after the valves, blood flow does not become turbulent, and for this reason, no murmur or sound is heard. But if we have aortic valve stenosis or pulmonary valve stenosis, it causes a pressure gradient or a jump in the gradient before and after the valve. And this leads to the blood flow losing its laminar state and becoming turbulent as it passes through the valve. And as we mentioned, it is the turbulent blood flow that creates sound, and we can hear this sound as a murmur with a stethoscope. Therefore, the turbulent blood flow and the murmur caused by aortic valve stenosis and pulmonary valve stenosis are both heard during the systolic phase. In the systolic phase, as we mentioned, we expect the mitral and tricuspid valves to be closed. However, if there is insufficiency of these valves, when the left ventricle contracts, some of the blood flows back into the atria. Because during systole, there is a gradient between the ventricles and the atria. During systole, the blood pressure in the left ventricle is 120 mmHg, while the pressure in the left atrium is less than 10 mmHg. Therefore, if there is a connection between these two chambers, due to the significant pressure gradient, the blood flow becomes completely turbulent and produces a loud murmur. During systole, the pressure in the right ventricle is also about 20 mmHg, and the pressure in the right atrium is less than 5 mmHg. For this reason, mitral regurgitation and tricuspid regurgitation also result in systolic murmurs.